Hello, and today we're going to be going over some taping procedures for the knee. One of the taping procedures we're going to identify is a method for supporting the ACL, MCL, and LCL. And this is indicated in patients who are returning to sport following an injury to the ACL, MCL, or LCL, and is often used post-surgically to give patients some extra support and confidence they need as they return to high-level activity. Items you need for this taping procedure is an adhesive undertape, which is commonly known as sensitive skin tape, and then a white tape, which is also known as Leukotape with some brands, and then specifically identifying how to do the taping process. It's important to note to the patients that these tape jobs are temporary measures aimed at providing additional support with them to aid in their performance during their recovery, and it's not a long-term solution, but merely a system to further progress their rehab in a safe and effective manner. Some items such as that need to be identified to the patient, where it should be important to identify if the patient is allergic to the particular adhesive you're using, or if they have any contraindications or symptoms such as DVT, active infection, fever, cancer, CHF, aneurysm, open sores, skin rashes or irritations, extreme hypertension, cognitive deficits, and any other limiting communication capabilities, or if they're bedridden. Another taping method that we're going to show you today is the McConnell taping technique to assist with patellar tracking. This tape method is to prevent knee pain caused by patellar tracking outside the trochlear groove and or from the patella moving inferiorly and compressing the fat pad. This technique can be applied to treat pain as well as narrow down pain generators for patients with patellofemoral pain syndrome and help lead the therapist in further treatment. If this taping method eliminates or reduces pain, this gives the patient immediate feedback showing that the therapy is working. Providing this immediate feedback will help assist in getting the patient to comply with more physical therapy treatments and help bolster compliance. This must be noted that this is just a Band-Aid and additional treatment will be needed to remedy this problem properly. This taping can allow the physical therapist to then look for other problems up the chain, such as trigger points or other soft tissue restrictions in the quads, glutes, or adductors that may be the potential cause for the patellar not to be tracking properly. Another tape job we want to show you today is patellar tendon taping. This is to treat patellar tendinopathy pain and is another method to immediately provide relief for a patient's pain. By using this taping method, you can treat the patient's pain and help determine if a patellar strap may be warranted to aid in the patient's recovery. This method is simple and requires few tools, so you can minimize the amount of equipment you have on hand for any given patient